So our next panelist is Mukesh only. So Mukesh Sabhrawal is currently the CEO, Chief Executive Officer at Asian Heart Institute and Research Center, Mumbai, which is India's #1 heart hospital with 99.83% success rate in the world. So I think maybe it is also the highest in the world also. So excellent work done by Dr. Pandya and his team, and he's currently now a multi-speciality large hospital, which is being managed by Mukesh. Mukesh is a influential C-level professional with over 35 years of experience, and he has worked with various companies in healthcare, medical equipment, eye care, and pharma industry. So first of all, Mukesh, I think on behalf of all the participants and panelists, we really thank you and various hospitals that you have been keep on working. Earlier you were with Apollo also, because the extraordinary work that the COVID warriors have done during the pandemic. I think you were at the forefront. Even you were infected with COVID, but then you kept going on after you recovered. So I think great work done there. And our question to you is, Mukesh, we can clearly see that there was a clear difference between the first and the second wave. The second wave was phenomenal in terms of speed and the way the infection has spread across the country. In the first wave, we were only seeing a vulnerable segment above 60 years or people with comorbidities. But in the second wave, we are seeing much younger people who got infected, and this wave was spread across India. And some of us do complain about the hospitals, lack of oxygen, lack of resources, lack of this and that. But we have to understand that if there is a capacity built for 100 and there are 10,000 patients will come, then how can anybody cope up? So private sector has done a great job, and we should not keep on complaining and keep on arguing about that. So what we would like to know from you, Mukesh, is the learnings that you had from both the waves from a hospital sector perspective, and also about what are the positive change that you feel, because we should not keep on talking about negative only. What are the positive things that you think have brought in, this pandemics have brought in people's attitude and overall well-being? One positive I think I can say is working from home. I don't think working from home could have ever happened, and many of us are now able to balance the family and work life.
I also worked from home for 4 months. In a healthcare industry, working from home is very different and difficult.
So over to you, Mukesh, please. Go ahead.
Namaskar to all participants and my co-host, as well as the leaders in the panel. I would first like to salute all the frontline healthcare workers, and almost more than 10,000 frontline workers, 1,000 doctors passed away during this pandemic treating the people. So big salute to they're like Matris for us, like the army soldiers. They have fought day in, day out, and I salute them from my heart. And especially the housekeeping workers. You should have seen the way the housekeeping team worked during pandemic, whether it was in a government institute or a private institute. Day in and day out, multiple level of cleaning, multiple level of infection was there, which was done, which helped in controlling the first wave very effectively. They were very, very important in the initial stage when the pandemic started off. The nurses, I said, please wear one day a PP kit and see for 1 hour what happens inside. We're all wet. You can't breathe. These nurses and paramedical staff and doctors have been wearing day in and day out. So we should see them as a leader in this pandemic, how they are surviving and how they are leading. What they have done, what the amount of passion, energy, and empathy, what they were showing to the patients during that time was great. In the first wave, I am talking. So everyone was focused, everyone was looking at that. The biggest thing that in the first wave was everyone was very proactive, including our Prime Minister Modi, because he was leading from front during that time. Lockdown was done on early set. Contact tracing was very well done, and wherever the case was found, that entire colony was getting quarantined. So that was the biggest area where the first wave got controlled down on a much faster pace. Only government hospitals were majorly treating in the initial stage, and they were getting picked up from the home, and movement was there. But as the contact tracing went off, the spread started off. And everyone was very happy. The praises were all across the India has fought well, gone, the wave is gone. India has conquered the COVID first wave. But no one knows this about this virus, when it will come back again. So everyone took it for granted, and that is how when the second wave hit in. When the initial wave, you say even 500 patients a day, it used to be a red alert. No one was moving out, no one was going out. Lockdown was taken very seriously, and lockdown definitely helped. And then later on, we have seen the labors going on. No one knows how the virus is spreading. It's spreading through air, it's all assumptions what are happening. We should not assume that you will not get infected or any. Each and every person in the world will get infected with this virus. Unless, even if they are vaccinated also, then also. The only good thing will be the effect of the virus will be less. Unless and until people get infected by the virus, this is not going to go. So everyone get injected as soon as possible if you want that the third wave reaction is less. The only worry in the third wave which is going to come is 18 years and below. Going to be dangerous because they are not vaccinated. So they have to be very particular, careful. They should kind of impose internal lockdown for them till they get vaccinated. They should stay home. They should not move out. Anyway, this is not a working class. This is more a education all across. No colleges have opened. They are doing online. They should stay. But between first wave and second wave, there was a clear lack of kind of very casual approach which was there. And when it was increased, because in the first wave, death rate was very less. And each and every member in the second wave I lost 5 of my family members at close relatives. They didn't knew. In fact, they were staying at home and they got COVID. So no one knows from where the COVID will come in. So your protection is the best protection. 3 things: sanitize, vaccinate, and mask. These are the only 3 things which can protect you from. But there is still no guarantee. You will get COVID. If people who have not got COVID, be prepared. Even if you are vaccinated, our managing director earlier, Sangeeta Reddy, after taking all the precautions, all vaccinations done on the first priority, everything, last month got COVID and she was admitted. But as she had both the doses, the effect was less. So if you have the vaccination and the doses is good, you will have. Be prepared. Prepare your organization for the third wave. It is already started. It is on the move. So I worked for 2 different organizations. Apollo, which was very proactive. Right from the beginning of the COVID start, they were very actively involved in supporting the government in controlling it. Whether it was opening the quarantine hotels, side-stay hotels, which were there, the first of the movement. Whether it was on the vaccination drive or procuring the vaccines, which was there, the biggest one. So they did a different thing. And if you see on the business front also, initially, everyone lost money. But later on, Apollo share has gone again, like Mr. Mukesh said, they have doubled their share value. Apollo doubled their share from 1,500, it went to 3,000 because they built and they thought future out. So they were proactive in the approach. There were a lot of hospitals where were reactive, and a lot of, initially in the first wave, government was shutting down the hospital. Even a COVID patient entered the hospital because I had to shut 5 hospitals where one patient just entered the hospital and was detected positive. And I had to quarantine all my staff for 21 days in a hotel. So that time no one knew. Then government said, "Ki band karo." COVID patient if goes anywhere in anywhere, That kind of a strictness was there, which was not there in the second wave. And self-medication was very, very common in the second wave because the prescriptions were out. You vitamin C le lo, ye kha lo, COVID nahi hoga. That doesn't happen. Coronel kha lo, Baba Ramdev ka yoga kar lo, kuch karo, nothing. You can prevent little bit, but you cannot protect yourself from it. So it is better. Protection is always better than you get into the cure factor. Secondly, one most important thing which happened compared to first and second wave, the preparedness of the hospital was not at all there, because everyone thought COVID is gone, so no one prepared for this is there, and neither the oxygen level or such kind of oxygen requirement will be there, because second wave infected lungs much more seriously than the first. The first wave infected senior citizen. The second wave infected the youngsters. That is where the maximum death happened to the system. So we were not prepared for the second wave at all. But later on, the Indian hospital industry, all private hospitals geared up, opened up, and government also supported in opening all and all. The biggest, what we are facing now is the complications of COVID. COVID is one. People are only say COVID hua, theek ho gaya na. Long-term treatment of COVID, when you have your continuation of medication of blood thinners and other, is very, very important. People don't take blood thinner. Then there are clot, there are cardiac arrest. Cases of cardiac arrest have gone up because people have not taken medication. Clotting has happened and cardiac arrest are happening. So heart cases have gone up very high. So it's not only during the COVID 14 days are over. The side effects of COVID are much more dangerous. The hospitals will be full for post-COVID symptoms or the side effects which are going to come. So be prepared and prepare your team members, prepare all the employees and educate them. Education is one which is very important. A lot of education has happened all across. But yes, people have become casual. People have to take this very seriously. Lockdown is the only answer to this. There is no other way you can kind of protect, and work from home is the new norm. So be prepared.
I think very important points which Mukesh is raising, that we all have to be careful, and third wave will come, and it is better to be prepared than just thinking that maybe it will not impact us. But I think second wave has clearly shown that it can impact us individually and also as a society. The only, I think, Mukesh, the good thing is that even your previous managing director got treated with a cocktail. Yeah. So now we have the cocktail. Yes. So don't take me otherwise. Yeah. Not that cocktail, but there is a cocktail of medicines which has come. Obviously, they are costly, but I think these medicines, if you are detected early and if you can take it on time, then you can recover. And the same were given to Donald Trump. Very. So there are, thanks a lot, Mukesh. I think a lot of work that hospitals have done, and we all salute to our COVID warriors.